All right, hey folks, Aaron Nicholas here, Monday Morning Dentistry, where I'm trying to give you all actionable items you can take with you and put into practice right away, like Monday morning, and just help be more efficient with practices, with the things that are going on in the practices, with your procedure. So today, what I'd like to talk about is preparation of teeth for operative dentistry. Okay, so let's say we're going to do an MO and a couple of occlusal composites. They're all in the same quadrant, very efficient. One injection, all three teeth are numb. Doesn't take that much longer to do three than it did to do one. Okay, so it's going to increase your profitability. It's going to be about the same amount of time, so you can be very efficient with your time. And guess what? Your patient doesn't have to come back 3 times or 2 times or whatever to do this. So we want to do them all at the same time. So general efficiency principle, don't ever do something twice that you could do once and be done. Okay, so whether it's a high-speed handpiece and a burr, and it's the same burr, or it's the same handpiece, you want to be doing it one time. So you pick up the high-speed, you put whatever your favorite burr is in there, so let's say it's a 245, and then you are going to do everything on these 3 teeth that you can do with the 245 burr before you take the burr out or put that handpiece down. Okay, let's say that once you get that done, you're ready to go and get the rest of the decay out of there. You're going to pick up the slow speed, and then you're going to clean out the decay. And then at this point, we should be ready to go. You know, occasionally you're gonna have to jump back and touch things up. But if you've done it this way 9 times out of 10, you're ready to go to fill this tooth, and you're not jumping back and forth, which takes time. You're not switching burrs, which takes time, and you just become much more efficient, okay? So let's say we're prepping this tooth. And I'm actually gonna put 2 in here side by side because we're gonna do an MO on this one. Well, we'll put all 3 in. Okay, so here we go. So there are 3 teeth, and we've got decay here on this tooth, and we know we have decay in the mesial, although we can't see it. And I'm going to give you kind of a sideways view of this tooth a little bit so we can talk about that. Here's our decay here, and there's the adjacent tooth. Okay, so you pick up the high speed, you take your 245 or your 330, whatever your favorite burr is, you put it in there, and you start to cut right down here where the decay is. And you popped into the decay, and so then you're going to make your outline form. So you're going to come around here into the grooves, okay? And let's say that once you've done that, guess what? There's still more decay here underlying the enamel. So you could put the high speed down, pick up the slow speed, and start to remove your decay here, okay? And we haven't even started talking about these 2 teeth yet, okay? This is the absolute slowest way to make this happen. So what we actually want to do is come in here, we've done our outline form, we're over here, let's say this one has occlusal decay also, and we've done the same thing. Okay? And then we have this tooth that we know we have mesial caries, and we're going to come in here and start prepping this tooth. So for this tooth, it's going to be a little different because what we want to do is prep straight down in a slot where we know we're going to end up until we catch that decay. So you're going to be coming straight down this way. So one of the best things that you can do when you're doing this is to keep just a sliver of enamel between you and the adjacent tooth so that you don't have to worry about nicking that tooth, and you can move a little quicker this way. And then as you start to extend this, what will happen usually is that little piece is going to fall away for you. Okay, so it's a really easy way to make the box without endangering the adjacent tooth. Okay, you're going to finish your outline form. Okay, now we've got to get the decay out. So hey, let's go grab our slow speed and remove the decay. Bad decision. So we're going to come back in here. We're actually going to extend our outline until we get back far enough that there's no decay, there's no caries under the enamel that we've prepped. Lay the burr at the angle you want it to be, move to the outside of the tooth, okay, until you run out of decay. Same thing over here. We're going to come this way. And same thing here with this box until we run out of decay, and we're moving here, we lose that little sliver. So now our outline form is perfect. We just need to get rid of decay. So now we're going to put down our high speed, pick up our slow speed, and now we're going to remove all the caries from our teeth. So at this point, we should be good to go ahead and to start restoring these teeth. Okay, so we're going to rinse dry and then go through our process. But you can see that by doing it this way, we pick up the high speed once, we've gone through and prepped everything, got it just where we want it to be, put it down, pick up the slow speed, clean things up, we're good to go. We're not going back and forth. We're not going back and forth between burrs or hand pieces. And at this point, we can go ahead and restore the teeth. And we've done it all at the same time. So everything's happening nice and smoothly. So that's pretty much it. Give it a shot, see what you think. Send me an email, shoot me a text, something if you disagree or if you have some suggestions. I'd be happy to hear those. And until next time, we'll see you later.